Good evening, everyone, and Happy New Year to you. I'm Andrea Foti, and I'm the Deputy Registrar and Privacy Officer here at the RCDSO. And welcome to tonight's RCDSO Connect session. Thanks so much for joining us. As you know, this session has been approved for one Category 1 continuing education point. To be eligible, participants must attend the session for at least 40 minutes. Just a reminder to get your CE point, no actions required. Our quality team will send your certificate to the email address that you use to register through Zoom. And we'll get that out to you within 5 business days following the session. So for tonight, we turn our focus once again to artificial intelligence. You might remember that the college hosted an RCDSO Connect session on AI last March. And just this past November, we published a comprehensive guidance document on the use of artificial intelligence in dentistry to help support safe, ethical, and responsible adoption of AI across the dental profession. You can find links to the past session and the document in the chat. AI continues to transform dental practice, creating opportunities to improve patient care, streamline workflows, and support clinical decision-making. At the same time, AI raises important questions related to accountability, ethics, privacy, and regulatory responsibilities. Tonight's moderated discussion brings together subject matter experts in dentistry, policy, and regulatory law. They will share information with you about our guidance document and provide you with practical insights on how AI is being used in dental settings, how it affects patients, and what dentists should consider when deciding whether and how to adopt AI tools. In terms of some learning objectives, by the end of this session, you'll be able to understand the key principles and professional and regulatory expectations around AI in dental practice, identify the main risks and benefits of AI tools and how they may affect patient care, and evaluate whether an AI tool is appropriate for your practice by considering patient needs, privacy and security, clinical context, intended use, and the tool's own limitations. So before we dive into the session, I'd like to start with a land acknowledgement. And this will focus on the lands on which the RCDSO's offices are based. So the RCDSO is on the traditional lands of the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat peoples. And these lands are known to some as Toronto. Toronto is covered by Treaty 13 with the Mississaugas of the Credit, and it's home to many diverse First Nations, Inuit, and Métis peoples from across Turtle Island. The land is also part of the Dish with One Spoon territory, which is a treaty between allied nations to peaceably share and care for the land. As the RCDSO, we accept our responsibility to each other and this land that we live and work on in a spirit of peace, friendship, and respect. We are and remain committed to actively supporting the necessary work towards truth, reconciliation, and equity. And over the course of this year, we'll be engaging in some really exciting work to advance reconciliation. We embrace our role in regulating dentists, protecting the public interest, and strengthening our partnerships with Indigenous communities to advance access to safe and equitable oral health care. So turning to our session, it is my pleasure to introduce tonight's speakers. Each of them bring a wealth of experience and offer a distinct perspective on the responsible integration of AI in clinical practice. So starting first with Dr. Zubin Austin. Dr. Austin is a professor and Koffler Research Chair at the University of Toronto. His work focuses on the future of regulation and how emerging technologies such as AI shape professional practice. He is widely recognized for his contributions to regulatory science and professional education. Dr. Austin has published over 300 peer-reviewed manuscripts and is the author of 5 books, including Regulation in the 21st Century, to be published later this year. I want to welcome back Dr. Peter Fritz, a practicing periodontist and chair of the Royal College of Dentists of Canada's Committee on Artificial Intelligence. Dr. Fritz works at the intersection of clinical innovation, technology, and law, and has helped develop national standards for safe and ethical AI adoption in dentistry. With an LLM in innovation, law, and technology, an MBA from Kellogg, and a PhD in molecular biology, Dr. Fritz is recognized for advancing frameworks that demonstrate how AI can enhance, rather than replace, clinical excellence in patient care. Next, we have Dr. Antony Liscio. Dr. Liscio is a long-serving RCDSO Council member and a member of the Standing Policy Working Group. That's the group that oversaw the development of the RCDSO's AI guidance document. With more than 50 years of experience in dentistry, Dr. Liscio brings extensive regulatory knowledge and a deep commitment to public protection. And last but certainly not least, we have with us Amy Block. Amy is a partner at WeirFoulds LLP, specializing in professional regulation and administrative law. Amy has considerable legal experience over the course of 15 years, litigating a wide variety of matters, including complex hearings involving allegations of sexual abuse, clinical incompetence, and incapacity. Amy has significant experience as appeal counsel, appearing at all levels of court, including Divisional Court, the Court of Appeal of Ontario, and the Supreme Court of Canada, Canada's highest court, on matters germane to administrative law and professional regulation, including licensing, investigative, and discipline matters. So I hope you'll join me in welcoming our very talented and experienced speakers, and I look forward to engaging in the discussion on this important topic. I'll now turn things over, please, to Dr. Liscio, who will kick off a presentation on the college's AI guidance document. Dr. Liscio.
Thank you very much. Good evening, everyone, and welcome. We'll start tonight's session with a brief presentation on the RCDSO's Artificial Intelligence and Dentistry Guidance, as Andrea pointed out.
Dr. Liscio, it just looks like you've got your mute on.
My apologies. We'll start with a brief background on AI in dentistry, followed by an overview of the college's AI in dentistry guidance this evening. We'll then highlight a couple of new resources for you, and then we'll move on to the panel discussion for the remainder of the session. Let's start with, what do we mean when we say AI in dentistry anyway? This phrase can seem abstract, so I want to show you some of the different ways that AI can show up in a dental clinic. AI can generate education materials like posters or customized handouts for patients. AI can also proofread and revise emails before they're sent out. And an AI chatbot or receptionist can answer common questions and book appointments, or AI could curate the music in your reception area. Moving on to the treatment room, there might be an AI scribe listening to the dentist patient's conversation while creating live chart notes. The dentist might use AI to analyze an X-ray for caries or search for more information about diagnosis. This just scratched the surface on how AI can be integrated into different aspects of dental care today. We can only imagine what the future might look like. Let's focus on one example to illustrate how AI tools can have benefits and risks. AI scribes are growing in their use among dental and medical clinicians, as well as other health professionals across Canada. In 2024, an Ontario pilot project found that participants saved 3 to 4 hours a week on paperwork, freeing up time to spend on patient care. They also provided improved documentation, increased job satisfaction, work-life balance, and perceived quality of care improvements. But let's keep in mind that AI scribes can also omit details and add incorrect information, such as noting risks that weren't discussed. AI tools pose risks as well, like diagnostic AI tools with high sensitivity and low specificity that can lead to overdiagnosis, unnecessary interventions, resulting in increased or unnecessary patient costs. These concerns are not merely speculative. Privacy breaches have already been reported in the news. As we developed this guidance, we reviewed early principles and guidance documents to understand the broader landscape and key issues. These include safety and security concerns due to the large amount of data used to train AI. Another risk is that AI can perpetuate bias if its training data isn't representative of different demographics. As a regulator, the college's challenge was finding the right balance between protecting the public and promoting innovation in our profession. As we developed this guidance, we reviewed early principles and guidance documents to understand broader landscape and key issues. These include safety and security concerns due to the large amount of data used to train AI. Another risk is that AI can perpetuate bias if its training data isn't representative of different demographics. Sorry. As a regulator, the college's challenge was finding the right balance between protecting the public and promoting innovation in our profession. The AI in Dentistry guidance was approved by the RCDSO Council in September 2025, as Andrea pointed out. It differs from our standards of practice, which set out professional obligations and expectations. Our AI guidance provides recommendations, I repeat, recommendations, in an area that is emerging, new, and ever-changing. This allows us to provide early guidance in an area that is rapidly evolving, where best practices are still developing to help guide responsible and ethical use of AI. We also published a series of frequently asked questions on our website to support your understanding of the guidance. You can find these on Standards, Guidelines, and Resources pages. The frequently asked questions provide further details about recommendations in the guidance and answer commonly raised questions. We have taken a risk-based approach in this guidance. Risk depends on the nature and intended use of the tool. Some applications are inherently low risk. Thinking back to the slide on the dental clinic, we would really be less concerned about AI used to create educational materials, provided, of course, that they've been reviewed for accuracy, than we would be about tools influencing the diagnosis or treatment planning. Risk to patient increases when AI tool directly shapes clinical decisions, affects patient health or safety, or uses personal health information. And greater risk calls for greater caution and oversight by the dentist. We've defined AI in the guidance as computer systems that can perform tasks commonly associated with human intelligence, such as pattern finding, problem solving, learning, and decision making. AI is already part of our everyday life, as we all know, showing up in web searches, personalized show recommendations, and virtual assistants like Siri and Alexa. These are also a couple of related terms describing forms of AI that have been more visible lately: machine learning and generative AI, which creates new content based on patterns learned from data. Concerns about AI often focuses on generative AI because it's novel and less predictable. ChatGPT, for example, and Google's AI overview are examples, and it can understand context, mimic natural language really well. However, there are risks, errors, or inaccuracies. I will highlight two of the main principles found in the guidance. First, the responsible and ethical adoption and use of AI in dentistry is guided by the patient's best interest. I repeat, the patient's best interests are key. When adopting AI, ask, is this tool will have a positive impact on patient care, or whether it addresses a real need? A second principle is the guidance emphasizes the dentist must remain responsible for their clinical care and decision making. AI is not a substitute for a dentist's own skills, knowledge, and judgment. It is not to be used to provide care a dentist is not otherwise competent to provide. In other words, dentists cannot really rely on an AI tool to make diagnosis or provide treatment that is beyond their competency to do so without the assistance of AI. This is because dentists must have the knowledge and the skill to be able to recognize when an AI output may be wrong or inappropriate, and thus provide effective oversight while using AI tools. As AI in dentistry is still in its infancy, the guidance doesn't set new expectations, but it does point to some existing relative ones as reminders to be aware of, to use the cliche, go into it with your eyes, ears, and mind wide open. It's a scary world out there. This includes the recently published Foundations of Professionalism, which replaced our Code of Ethics, standards such as consent to treatment and record keeping, and legislation and regulation such as the Professional Misconduct Regulation under the Dentistry Act and the Personal Health Information Protection Act. While we have highlighted some of the recommendations in the guidance, this is not by any means a comprehensive review. We've highlighted recommendations that support dentists' critical role in overseeing the use of AI and exercising their own best judgment. This includes really understanding the tool, including its risks, its limitations, and how do we mitigate them, and getting appropriate training, not only for yourself, but also for your staff using the tool. When using the AI tool, this means reviewing outputs for accuracy, completeness, potential biases, and ensuring that decisions that you make reflect the patient's unique circumstances and well-being. In our consultations, we found that patients highly value transparency around the use of AI. Transparency supports patients' autonomy and informed decision-making. and it does help build trust in dentists' use of AI, especially as the technology is still relatively new and, as I said before, evolving. The guidance recommends informing patients if they are interacting with AI, for example, such as a virtual chatbot, to inform patients when you will be using AI in their care, and to reasonably accommodate patients' wishes around the use of AI. Dentists continue to have obligations under Ontario privacy laws and are advised to understand the specific privacy and security settings and measures of AI tools, and to opt out of using AI outputs as training data unless express consent is obtained. Now, in addition to the guidance, we recommend taking a look at the additional resources linked in the guidance. These include several documents and tools, such as practical resources for clinicians who are intending to implement AI tools, and also privacy impact assessment guidelines. We've produced a couple of new materials to share with you today. We've developed a checklist to help you think about the questions to ask as you decide whether to adopt an AI tool or not. For instance, questions about data protection and security, training data, clinical validity for clinical tools, risk management, and performance monitoring. We've also produced a patient brochure to help explain AI in dentistry to the public and all that it encompasses. Thank you very much for your time. We'll now move on to our panel discussion for the rest of the evening.
Thank you very much, Antony, for walking us through the overview of the guidance document, as well as the other resources that have been produced by RCDSO. AI technology is evolving quickly, as you point out, and RCDSO has created these resources to guide dentists in their decision-making. With what you've presented as an overview and as a foundation, we are now going to spend the next 40 minutes or so talking about how these principles could be applied in practice on a daily basis. And to help us put all of this into a practical context, we're going to start with a case scenario, a case study, and to help us to understand how this applies in the real world. A general dentist adopts a cloud-based AI imaging tool designed to assist with early detection of oral cancer, caries, and periodontal disease. The tool requires uploading patient radiographs and claims a 95% accuracy rate. The dentist has used the tool for several months and generally finds it reliable. He routinely reviews and confirms its outputs as part of his workflow. As we move forward and discuss this scenario with our panelists, please keep the specifics of this in mind. And we'll start by asking Peter, as a clinician, as a practitioner, as you think about that case, and as you reflect on your activities in terms of adopting an AI tool, what information would you want to understand to assess whether it's appropriate to use this in your practice?
Thanks, Zubin. When I evaluate any tool for my practice, I think about it almost exactly like vetting a new dental assistant. I need to understand their training, their limitations, and whether they're the right fit for my patients and for my team, right? This isn't just about buying a product, it's a professional judgment decision. And before diving into specifics, I'm always wondering what category of AI am I dealing with? Because as far as I understand, there's 5 domains. Is it an operational AI, which is like for scheduling? Is it diagnostic for caries or perio detection? Is it a predictive AI that's going to help us with prognosis and outcomes? Or is it a professional or compassionate AI program? But with this clinical task, I like to, with your scenario, I like to ask, what's this tool actually designed for? And in this scenario, we're talking about caries, perio disease, and oral cancer. Those are 3 very different diagnostic domains with very different consequences if the tool gets it wrong. Right? Is the tool meant for screening or diagnosis? Because those are also fundamentally different claims. And I also want to know who the tool was trained on. If it's mostly on a single demographic, that may not perform well in a diverse Canadian population. And this really matters because this is a problem that relates to equity. Then I think about validation and accuracy. You get all kinds of claims that are there. And, in this scenario, it's 95% accuracy, but 95% of what? Is it sensitivity? Is it specificity? Positive predictive value? And what setting is this in? A 95% sensitivity for oral cancer sounds great until you realize that it means 5% might be missed. And in a busy practice, that's not a small number. I also wonder where it's been validated. Is it in a real world clinical practice or just a controlled academic setting? And has that validation been peer reviewed, right? That affects how much weight I give it as well. And then it goes to privacy, data, and security. If I'm uploading patient radiographs into the cloud, I need to know where the data is stored. Is it staying in Canada? Is it encrypted, right? I'm responsible for ensuring that the patient data isn't used for secondary purposes like retraining the AI or, selling the data. And then I'm like, how does this tool actually fit in our day-to-day workflow? Is this really going to help us or is this a diversion? Right? Will my team need a lot of training? And who reviews the actual AI output? And when does that happen? So there's a lot of questions. And fundamentally, does it support clinical decision making? Or is there actually a risk that it pressures the decision? So when I wrap it up, I think if you wouldn't hire it as an assistant, then don't plug it into your practice. And if I can't understand the tool well enough to explain it clearly to a patient or a colleague, I'm not ready to use it.
Thank you for those reflections, Peter. Certainly a lot of questions we all need to consider when we see these bright and shiny new tools that come on the horizon and promise to do so much. I want to pick up on one particular thread you articulated, and that had to do with your ethical and professional responsibilities with respect to privacy and security of the data. I'm going to ask Amy to reflect a little bit in the context of making a decision to adopt an AI tool. What are some things that would be important for dentists to consider, specifically from the perspective of privacy?
Yeah, thank you. I just want to preface my remarks by saying I'm speaking today in my individual capacity and I can't offer legal advice to the group. I'm not here to offer legal advice or speak on behalf of the RCDSO, but I can share my views and reflections, and particularly as they pertain to privacy and security in this context. As a regulated professional myself, I do identify privacy as one of the very serious considerations for anyone considering incorporating AI into their professional practice. And for dentists, of course, privacy considerations are heightened when the regulated professional is dealing with confidential personal health information. And there are a myriad of obligations that healthcare professionals need to consider. They can be rooted in college guidance and college regulation and college policy, but also in provincial and federal, in some cases, federal privacy legislation that might apply that you need to be aware of. In the guidance document actually helps by pointing to some questions which I think are appropriate in this case because you're uploading radiographs, the data is being stored. So the kinds of questions you need to ask yourself is, does the AI tool have access to and use patients' personal health information? In this case, absolutely it does. Does it comply with Canadian federal legislation? Does it comply with provincial legislation, PHIPAA? What are the privacy and security settings? And do I understand them as the user of them? Because I will need to understand them to obtain consent, which we'll talk about later. Are robust security measures in place? What are the safeguards against privacy breaches? You don't want the tool you've adopted to be in the headlines for the massive security breach. Where is the data collected? How is it used? How is it stored? How is it retained? What are the outputs being used for and for what purpose? So that was my really quick run through of some of the privacy and security considerations.
Thank you, Amy. Both Amy and Peter have sort of framed their responses in terms of a series of questions that we need to ask ourselves before we actually go out and purchase and implement new AI tools. In your presentation, Antony, you showed us and started to describe a little bit about a new tool that RCDSO has developed, the AI tool checklist. Could you tell us a little bit about how the checklist could be used as a practical framework to support decision making?
Thank you very much. The checklist is really, really useful. We've heard several factors about dentists, what they should be considered when deciding to adopt an AI tool or not. This is where the RCDSO AI tool checklist really becomes practical, a practical roadmap, shall we say, for applying new technology. It's designed to help dentists move beyond intuition or marketing claims. Think about it as a framework to ensure that as we innovate, we stay grounded in patient safety and professional accountability. The checklist is not meant to approve or endorse specific AI products. Instead, it actually provides a framework for informed decision-making, ensuring that any tool used in practice aligns with professional standards, patient safety, and absolutely ethical considerations. What it does, it encourages dentists to ask questions such as, what is this tool designed to do, as Peter mentioned? Was it designed to do this, or was it designed not to do this? Is it important clinical judgment or attempting to replace it? What evidence exists that it works reliably in dental settings? Does the tool have Health Canada approval? Could there be bias limitations in the data it uses? How is patient data being collected, stored, and protected, as Peter mentioned? Does it store data in Canada, or does it use de-identified information model training without specific consent? Dentists can use the checklist to think about practical considerations, such as whether the tool integrates smoothly into their workflows, or whether additional training or staff support will be required. Most importantly, the checklist reinforces that human oversight is always required. No matter how sophisticated an AI tool is, accountability for clinical decisions remains with us, the dentists. In practice, the checklist can be used before adopting a tool, during staff onboarding, or as part of ongoing quality assurance. By prompting reflection on evidence, limitations, and workflow integration, it helps dentists make thoughtful, defensible decisions that ensure use of AI is both ethical, legal, and truly in the patient's best interest, without at the same time discouraging innovation or adoption of useful tools.
Thank you. Clearly, for those who aren't quick enough in writing down all of the great guidance Peter, Amy, and Antony have just given us, the checklist provides a very useful resource as a starting point to ask important questions when we think about adoption. So once a tool has been adopted, how should dentists approach informing patients that AI is going to be used in reviewing their radiographs? And why is transparency about use of AI important for patient trust and informed decision-making? Peter, let me start with you.
Sure. We get asked this a little. This is a really important concept. I've been using AI in my practice for the last 3 years, and I've come to look at it like a supporting tool, not as a secret weapon, right? Transparency isn't just a checkbox. It's a chance to actually build trust with the patient as you're exploring this new technology together. So when I inform patients that AI is being used to help review their radiographs, for example. And this is a hypothetical situation that you set up for us, Zubin. There is no tool that does caries and perio and oral cancer, right? That's an imaginary situation still. But when I'm explaining the radiographic support of this technology, I give them like just a really short, clear conversation. They don't need like a big technical breakdown about the algorithm or how this thing works. They need to know what the tool does, why I'm using it, and that I'm still the one making a decision. So you got to be clear when you're looking at this. AI is not a truth-finding machine. There's no AI application that's built to find the truth. AI applications create information, but information isn't truth. Truth is a subset of information, and often a really little one. And as clinicians, our role is guiding patients through all this noise to find what's true for them. And that's our role. Right, so how I explain it is I say, we use a computer-based tool that helps analyze our x-rays. It looks for patterns that could suggest areas of concern, but I always review the results and make the final call myself. Another way I do it is I say I use a computer-based tool as a second check. And I always review everything myself, but it helps make sure I haven't missed anything, right? So there's a benefit for the patient for me using this. And why is transparency important? Because patients don't like surprises, right? Especially when it comes to their health. And if they find out later that AI was used to make a decision they weren't told, it can feel deceptive, even if the care was excellent, right? So we're not just using a new tool, we're introducing a new actor into the care process. And this really deserves a heads up for the patient, right?
Mm-hmm.
Transparency supports informed decision making. It protects the trust that we're working so hard to build, and it reduces the risks of complaints or misunderstandings down the road. So I think about it, if I had to call a pathologist to get a second opinion on something, I wouldn't hide that from my patient. I would tell the patient that. And so you don't hide that you used AI to help make a better decision.
I like the way you frame this also in the context of helping to build a trusting relationship with the patient, and that being so important. Amy, building on Peter's comments, and particularly his clinician's perspective of relationship building as an important outcome of disclosure and transparency, what other considerations are important for dentists to be aware of regarding personal health information, consent, disclosure, transparency?
Yeah, I think transparency and building a relationship of trust is one side, and the other side is the legal obligations to obtain consent. And when that comes to personal health information and AI, many of the legal obligations are spelled out. One source, for example, is PHIPAA, the provincial privacy legislation, which I'm sure practitioners are familiar with. To be clear, where consent is required by law, it's not only required for disclosure of personal health information, but also its collection and its use. And so that's something that we may not always be turning our minds to in adopting AI. That's why it's essential that as adopters of AI or users of AI, we understand what is the data that's being collected, what is being retained, and exactly how it will be used. And Peter mentioned that at the outset. Without that understanding, you can't actually assess your obligations, number one, but also you can't obtain meaningful consent because you need to understand that to actually inform your patient and properly obtain consent. I think Dr. Liscio's slides at the outset showed an image of AI in the waiting room, for example, in 3 places where it was in the waiting room. But what comes to mind is that AI is becoming quite ubiquitous, even without us noticing. So things like apps on your phone, Google Translate, Google Lens, they may be using personal health information that you're inputting, and it may be being used for other purposes. And to do that, you require explicit, meaningful consent from your patients. So I think I'll end just by highlighting the college's guidance. The guidance specifies, do not permit AI-generated outputs containing personal health information to be used for other purposes, like training the tool or sharing with third parties or selling the data, as someone suggested, unless patients have provided express and knowledgeable consent to the specific use of their information for that purpose.
Good. Thank you so much for those comments. Well, let's take a look at things as our scenario evolves. And we're going to now look at part 2 of the scenario and the next steps. So during a routine exam, the AI tool flags a radiographic finding as high risk for oral cancer and recommends immediate biopsy. The dentist performs a visual exam and palpation, but finds no obvious clinical signs. Based on that dentist's experience and clinical judgment, the dentist believes the risk is low and that monitoring may be appropriate. So, Peter, this sets up a situation where there may be conflicting judgments between a clinician and AI. How can a dentist balance professional judgment when it conflicts with what seems to be such a confident and certain recommendation made by AI? And what kind of documentation or disclosure practices would be essential from your perspective in such a situation?
Yeah, this is where clinical judgment collides with the AI recommendation. And it's a pressure point that every dentist is going to face if they're going to use this technology. And the situation is very realistic. AI says high risk, your clinical judgment says low risk, right? What do you do? And that's exactly why we have professionals, right? If AI could replace clinical judgment, we wouldn't need dentists. So that's sort of the framework that I look at is with if I have a dispute with it, if I don't see clinically what it's suggesting, I ask myself sort of three things. Could the AI assistant application be seeing something that I've missed, right? So I go back to the image, I look again, is there a subtle shadow? Is there a symmetry? Could I have missed something? And often that's the case. And then if I disagree, if that's not the case, I'm like, is there any additional testing or consultation that could clarify the picture better? So you consider, is there maybe additional imaging? Is there a different angle? Is there a different modality? Should I refer this to a specialist or bounce it off a colleague, right? And then third is the most grounding part. It's like, what would I do if AI wasn't involved? Like, what would I do? And if your clinical judgment, independent of AI, says monitoring is appropriate, that's really important information, and you need to listen to that, right? Because the dentist must remain the captain of the clinical ship. And that includes navigating any disagreement. So you may agree with AI, you may modify its recommendation, you may respectfully disagree. All those are valid outcomes as long as the decision is reasoned, right? And not reflexive. So documentation, like everything we do, is key here. So when I diverge from a recommendation or when I use a recommendation, I make sure to note what AI was used, what it recommended, what my clinical findings are, why I chose the path I did, and the patient discussion. So these tools are typically tuned for sensitivity, as Antony mentioned at the beginning. They're designed to overflag rather than underflag. And that means a lot of false positives. And any of you that have used this, the caries detecting radiography tools, you find that it's very aggressive in looking at this. But here's the flip side. You and I went to dental school to spot the outliers. The outliers is where there's risk, right? And AI is not as good as you at finding them, right? So we have to be in control. So AI will miss the outliers, the atypical presentations that don't fit the training data. And that's where your clinical judgment is irreplaceable. And the danger isn't that AI makes mistakes. It's the danger we stop noticing when it makes the mistakes. And it makes them all the time. So ignoring AI without reflection is just as dangerous as deferring blindly to it. And also use trusted AI programs. I'm so worried about good dentists using bad algorithms and having unfortunate consequences with that.
Thank you. Amy, Peter raises some really interesting questions. In the context of the real world, though, you have these high-tech bells and whistles, incredibly sophisticated AI systems that just look so much smarter than you or me or even Peter. And it's hard to sometimes disagree with something that a computer tells you to do. What happens if a dentist follows guidance from AI, but it actually proves to be incorrect?
Well, I think I'd start the answer to that question by sort of analogizing to my own profession. And I would say, as professionals or healthcare professionals in the context of dentists providing care, the professional is responsible for that care. Members of the public we know seek the services of a dentist because they are a registered and regulated professional, and registered professionals, licensed professionals, are expected to have the knowledge, skill, and judgment to practice the profession. And I think we've heard from a number of speakers tonight that AI is not intended to be a substitute for that kind of knowledge and judgment. So I think generally practitioners should be under no misapprehension that the heavy lifting of the professional work can be shifted to AI. And the flip side of that, or the result of that, is at the end of the day, the practitioner is responsible for maintaining the standard of practice. And of course, I'm only speaking for myself here, but I would expect that if a practitioner in any profession blindly relied on AI to be blindly relied on AI, I would not expect that to be an acceptable, I guess, excuse, for lack of a better word, for poor decision-making or substandard care. At the end of the day, AI is not a substitute for competence. So sort of linking back to your initial question, I would say following AI, the bottom line is you shouldn't be blindly following AI. And I think Peter's advice was quite clear about that. You should be exercising your clinical judgment, and AI is one piece of information in that spectrum, in that basket of information you have. Your own knowledge, skill, and judgment should inform your professional decision making, whether you're a dentist, a doctor, or a lawyer, and that AI simply isn't a substitute for that. I don't want to catastrophize about wrong decisions, but I think that's the sort of bottom line when it comes to AI.
Okay, thank you, Amy. So we've talked a little bit about decision making, but we also need to talk about disclosure and documentation. Antony, should the dentist disclose the AI's recommendation to the patient, even if the dentist does not agree with it? And on a practical way, how do you approach a conversation like this? What kind of guidance has RCDSO developed to help dentists navigate these difficult conversations?
Thank you, Ruben. I'll take the first part of the question about disclosure. So disclosure, documentation, and accountability, as we've heard numerous times this evening, are where AI guidance becomes a very real in day-to-day practice. One common question is whether a dentist should disclose an AI recommendation to a patient, even if the dentist does not agree with it. Dentists are not required to disclose every internal input used in clinical decision-making, including AI tools, particularly if that input doesn't materially affect patient care. However, AI often functions as a background decision support, similar to other diagnostic aids. However, disclosure may be appropriate when an AI recommendation significantly influences the discussion. The AI suggested a materially different option, or the patient specifically asks about AI involvement. When these conversations occur, framing is critical. AI should be described as a supporting tool, not a decision maker. Suggested language might be, we use computer-based tools that can help us analyze information, but I always review that information myself and make the final clinical decision. If a patient asks directly about what AI found, the dentist should absolutely respond honestly. That includes explaining whether the AI recommendation was considered and why the dentist agreed or disagreed with it. It's important to avoid technical jargon, as Peter mentioned, or overstating AI's capabilities. Dentists can explain that AI is good at recognizing patterns, but it does not understand the full clinical context, and it does not replace professional judgment. Patients should leave the conversation confident that their care is being guided by a licensed professional, not by a computer. With regard to your second part of the question, Ruben, documentation. Documentation is one of the most important risk mitigation strategies when using AI in clinical practice. When a dentist overrides or diverges from AI recommendation, the clinical record should clearly reflect that professional judgment. In other words, document the why. This includes patient-specific factors such as patient history, symptoms, examination findings, and diagnostic information. It's important to note that an AI tool was used as part of the decision support. However, the record should not suggest that AI made the decision. Essentially, it was just a data point. My clinical expertise was the deciding factor. The dentist remains accountable. Maintaining an audit trail may include documenting the AI input was reviewed, the data version of the tool, was it relevant, the final decision. This supports continuity of care, professional accountability, and defensibility if decisions are ever questioned. All AI recommendations can be documented, but responsibility cannot be delegated.
Very important concept. Thank you, Antony. One of the concerns that many people have, not simply in dentistry, but in every profession, is the concern that over time, regular reliance on AI tools could contribute to something called de-skilling of the workforce. where we just become so used to relying on AI and so comfortable with its recommendations, we literally start to forget how to do certain tasks, or those skills become less acute than they ought to be. What are your views on the potential impact of de-skilling on the dental workforce, Peter? And what should we be thinking about and doing now to prevent or mitigate this risk?
Sure. Over time, passive resilience is foreseeable. People like to take the easiest path forward. It's human nature. But this shouldn't be a fear of AI. It should be, I want to flip it, and I want to look at it as there needs to be a maintenance of competence, which turns out it's already a professional obligation. So, where the risk is highest is with pattern recognition and diagnostic interpretation, which is really the bread and butter of diagnostic imaging. So if you use AI to detect caries for 5 years, will you still detect caries as well without it? Or are you going to take the AI recommendation more freely? And what happens when that system should go down? So the way I like to mitigate this is think about when I use an AI program for caries detection, I always look at the radiograph first and then come up with my judgment. And then I double check and I use the AI application almost like an answer key in a test. And you remember in dental school, and we had these packs of tests that we had to read, and you'd look back and you do the test, and all of a sudden you look in the answer key and you go, that's wrong. And you're like, well, the same thing happens with the results from AI. Like often the answer it gives you is wrong, and you know it's clearly wrong, but that's why you're in the picture still. So look at the radiograph before checking what it says. Periodic AI off calibration. Occasionally turn the AI off and remember what it's like to work without this, right? You want to maintain your baseline skills. Critical to this is in this group of people interested in this, peer discussion of AI disagreements. If you see a pattern that an application isn't working well, check with colleagues, talk about it with colleagues. This is how we're going to identify this because we are the experts. There's this disintermediation of expertise, and that's why being an expert and being a professional is going to be more important than ever. And then continuing education focused on fundamentals. Keep your foundational diagnostic skills sharp. Don't let the shiny new tech erode clinical excellence. Now, there's some great programs on AI and how to use that in dentistry. That's great, but make sure you don't lose the clinical excellence part of it. So AI should be a second set of eyes, not a replacement for the first. And the day you can't practice without AI is the day AI is practicing through you.
Very, very insightful thoughts. Thank you, Peter. As we wind up today's panel discussion, I'm going to ask each of you in about 1 minute or so to reflect on what you, from your perspective, think is the best piece of advice you could offer our audience members to help them in supporting responsible and ethical adoption of AI in their practice. Let's start with you, Peter. What's one piece of advice you'd want to give?
Start with the problem, not the technology. Don't adopt AI because it's exciting, because everyone's talking about it, because the vendor gave you like a great presentation. Start by asking, what's my problem? What's the clinical or operational problem that I'm actually trying to solve? And once you've identified the problem, then evaluate whether that AI solution genuinely addresses it and whether it does so safely and ethically. So start with low-risk, non-clinical tools like patient education materials. Choose tools that are transparent. Can you explain what it does? Can you explain it to patients, right? Choose tools that support your judgment, not shortcut it. AI should make you a better clinician, not a faster one who thinks less. Use the RCDSO guideline, the checklists. It walks you through these exact considerations and move slowly and deliberately because there's no prize for being first. The prize is for getting it right. So if you remember, we've got more than 2,000 dentists here today. Taking time to learn about this tells me our profession is approaching AI thoughtfully. And that's exactly how it should be. So take time to learn more about this. Take some courses in it. And remember, Ontario dentists and the RCDSO in particular, they're leading this conversation, not following it. And what we learn here is going to shape practice standards, not just in Ontario, but across North America. So congratulations on being part of that today.
Thank you, Peter. Amy, what's one piece of advice you would offer our audience to help them to consider what is necessary for responsible and ethical adoption of AI in practice?
Well, I would certainly echo Peter's comments. And I think one point that's emphasized tonight through all the speakers is that as the professional, as the practitioner, you are the bottom line. The buck stops with you, so to speak. And as exciting as the tools are, they are not a substitute for your professional judgment. So part of using AI responsibly and professionally means you really do need to understand the tools and its benefits and its limits and ensure your own competence in using those tools. So I think education is key. Seminars like these, courses, consulting your peers, not doing this in isolation, but really diving in and fully understanding the landscape. And I would also say I wouldn't hesitate to engage experts if you're considering adopting a specific tool. There may be all kinds of experts who can help you depending on the nature of the tool and whether to adopt it and how to adopt it. So there's legal experts, there's the experts in privacy obligations and technology. There may be practitioner experts out there, and Peter did not put me up to this, but quite frankly, if I were going to adopt a tool, I would want to engage Peter as an expert. And he, in fact, may have courses on the subject, and there may be additional kind of learnings. But I wouldn't shy away from it. In fact, I would dive in and really educate yourself and give yourself the tools to ensure you're properly informed.
Thank you, Amy. We'll leave our last word for Antony. What's your piece of advice to those in the audience thinking about responsible and ethical adoption of AI?
Thank you, Ruben. My advice is to consider AI and as adopting it, to prioritize it as a patient-first principle. You cannot delegate your professional judgment to an algorithm. To begin safely, the guidance emphasizes due diligence by prompting dentists to think about evidence, limitations, potential bias, data privacy, and how the tool fits into existing workflows in your own practice. Before you purchase a tool, you should research the vendor's product if it's safe, if it's transparent, if it's unbiased. Here's some key questions to ask a vendor, for example. Is it licensed? Request proof that the tool is evaluated under Health Canada's guidance of medical devices. What is the tool's training data? Ensure the data set reflects the diverse population you serve. Is it transparent? Can the tool explain its reasoning? Understand how it arrives at conclusions is crucial for validation. How is the data protected? Does the vendor provide legal agreement and use encryption that complies with Ontario's privacy laws? Periodically reassess the tool that it actually is improving patient care or whether it's introducing new risks or inefficiencies. Responsible AI adoption isn't about avoiding innovation, it's about integrating innovation thoughtfully and ethically in a way that maintains patient trust, upholds your professional standing, and at the center of your practice. Most importantly, dentists should remember this. AI is meant to support, not replace professional judgment. No matter how sophisticated a tool may be, accountability for clinical decisions remains with the dentist.
And with that, I'd like to take the opportunity to thank all of our panelists for sharing their insights and reflecting on this case. And I hope that it's provided all of us with an opportunity to take away our own learning from tonight's discussion. Let me turn it over to Andrea to wind up tonight's presentation.
Wonderful. Thanks so much, Zubin. And firstly, let me thank all of our presenters for such a fantastic session. You've given us lots to think about and really lent your expertise with us. So thank you so much. And for all our attendees, we had a great turnout tonight. Really appreciate you joining us. Again, as a reminder, you don't have to do anything to get your CE certificate. We will be sending that to you within 5 business days. As we wrap up tonight, just as the panelists have said, really would encourage you to learn more about this topic. AI is evolving quickly, as you know, and staying informed is going to be essential. So our artificial intelligence guidance document is a great resource. If you haven't taken a look at it, please do so. And Antony had taken you through the FAQs. That's a fantastic resource as well. I want to highlight The documents that Antony talked about, the checklist for dentists, the patient brochure, they are included in a learning in action toolkit for AI in dentistry. And the toolkit itself contains a total of 5 actions. And this is an opportunity for you to earn additional CE points. For each action you complete, you'll earn 1 CE point in category 2. So while we encourage you to do all 5 actions, you aren't required to do so. I just want to highlight as well, we have a new professional practice resources section on the RCDSO website. This is a dedicated space that brings together practical toolkits, information about Category 1 courses offered by the college, and other materials that are there to support you. We've shared a link to that section in the chat and just encourage you to explore it and bookmark it. And as always, if you have practice-related questions, please reach out to our practice advisory service. We have a talented group of individuals there who are ready to assist you. And you can reach them by email at practiceadvisory@rcdso.org or by phone. Social media accounts to stay on top of updates and latest news. And really hope you can join us at a future RCDSO Connect session. We have 2 coming up in February. One on February 10th, which is an information session about 2026 council elections. And then we have another Category 1 session on February 25th. So please check your inboxes for more information. Thanks again so much for joining us and enjoy the rest of your evening.